Have you ever been given drugs in the hospital and you notice that the drugs are either repackaged or the name scratched off? Well, welcome to Nigeria's private hospitals. This is a health show, your number one health content creator. Now, in Nigeria, private hospitals are much more accessible form of healthcare. Now, much more than the government owned. They can be found on almost every turn in some urban areas. Now, what they do is they replace the persistently low quality and inadequate health services provided in some public facilities, not public health facilities. Now, if we are to compare data, patients at some private hospitals are more likely to survive than those at public hospitals because the staff at the private facilities tend to put in their best because of the immediate repercussions of not doing so. However, this is not always the case since some of these private hospitals need to be managed properly or totally wiped off the surface of the earth. Now, in some cases, private hospitals are death traps and they can be the shortest route between any sickness and death, even headache. Now, sometimes and many times, doctors who own these private hospitals are also employed as consultants elsewhere and would actually not be around themselves or have any doctor on ground in their hospitals. Now, the trained quack nurses in this hospital who sometimes replace and do the work of licensed nurses, doctors, and pharmacists and can be a health risk to many patients who work in. In another video, we talked about quack nurses and how privately owned hospitals are the machine that churn them into the society. Now, another problem with private hospital is that they can be costly. Now, this is quite understandable given that the current economy situation is not friendly. All right. However, this leads us to the main public health problem caused by private owned hospital, which is repacking drug items. One popular trend the private hospital engage in keeping their patients committed is peel off the labels or picking the drugs out of their original sachets and placing them in a new unlabeled envelope for the patient. Now, in their defense, they have two reasons for this. Listen. First, they say they are trying to prevent the patient from self-medicating. Now, this is ludicrous. You do not say because you do not want your child to have bad friends, then you blindfold them as they walk the street. We all know the best thing to do is to cut off their eyes, but that's not the point. Now, the point is that is a very ridiculous excuse to say in order to prevent self-medication. Now, the other reason they give for repacking drugs, some of these medicines are popular and have identifiable packages. Now, these patients have an idea of the cost of this medicine. It can hinder them from placing extra charges on these drugs for them to be able to break even. This also does not even make sense. All right, the last time I checked, doctors are professionals. You can also attach a professional fee to your service, and patients will gladly pay you as soon as you meet your professional responsibility. For example, some hospitals are costly, but you still find patients going there because they get the satisfaction that they need. This is different from some private owned hospitals. They don't want to provide professional care, but they also want to jack up their price. You can't get both sides. Repacking medicine is criminal and can put the patient in danger. One of the rights of being a patient is knowing the name of the medication you are on and also be able to identify them in case of an emergency. That is a right. Now, in a few weeks, this show, we are going to analyze the rights of the patient and all the things you need to know before walking to a hospital and a pharmacy. Now, but to mitigate this evil trend, there should be proper regulation of private hospitals, especially in the rural areas. Now, rural areas are the places where these sharp practices occur most. Now, the reason for this is because they have little or no chance of proper regulation. Now, another solution is partnership. Because of the cost of running a pharmacy, private hospitals may have to partner with community pharmacists to open branches in their hospital, and this can encourage better drug handling, cheaper, and also increase the availability of drugs. Now, for those who cannot afford to access healthcare in private hospitals due to the high cost, you can get a health insurance. Now, health insurance is a type of insurance that covers the whole or part of the risk a person incurs, such as medical bills or expenses. Now, in simpler terms, it's an agreement in which an insurance company agrees to pay for some or all of your medical expenses in exchange for a monthly or yearly premium. In another video, we'll discuss the different health insurances, policies, and how you can get on board. For now, ensure you know the name of the drug you get in the hospital whenever you get there. Ask about the name, ask how it is taken, and when to stop. You can also ask about the name of your doctor for easy referencing, either for good or for bad. Thank you for staying tuned to the end. Before you go, you can share your private hospital experience in the comment section. Let us know if you're satisfied visiting any pharmacy or a hospital. Remember to like, share, and subscribe to this channel. Bye bye. See you.